In this video, we will learn about the drugs fluoroquinolones. The history of fluoroquinolones, it begins with the discovery of quinolone antibiotics in the mid-20th century. The quinolones, they were synthetic antibacterial drugs. They were first developed in 1960, and the first generation quinolone, it was nalidixic acid, which was developed in 1960. It was effective against a limited range of bacteria and also had limitations in terms of the spectrum of activity and pharmacokinetics. The breakthrough in the development of fluoroquinolones came with the introduction of fluorine atom. So this was a quinolone, and when they added the fluorine atom into it, and they become actually fluoroquinolones. So this was the breakthrough in the history of the fluoroquinolones. So the modification, it greatly enhanced their antibacterial activity, the spectrum, the pharmacokinetic properties. So nalidixic, it was a precursor of the first generation fluoroquinolone, which was ciprofloxacin. This was the first fluoroquinolone that came into the market, and it was introduced in 1980. So this was the first drug, and over the years, further modifications they led to the development of second, third, and fourth generation quinolones as well. So there is a classification of fluoroquinolones based on their spectrum of activity, and they are divided into three generations. The first generation, it contains norfloxacin. The second generation, it has ciprofloxacin and ofloxacin. The third generation, it has levofloxacin, genifloxacin, and moxifloxacin. So the first generation, it has activity against some pathogens, and they're used to that causes UTIs, and it does not have a very broad spectrum of activity. Whereas cipro and ofloxacin, they have very good activity against gram-negative bacteria, but they have limited activity against gram-positive bacteria. So a triple plus for gram-negative bacteria and the gram-positive bacteria, they have activity but very limited activity. So as we go down from first generation to third generation, the activity against gram-positive actually increases. So in the third generation, they're more active against gram-positive bacteria as well. They have activity against gram negative, and along with that they are more active against gram positive bacteria as well. So this is the transition from first to third generation bacteria. So they have activity against gram positive and gram negative, and they are also active against, like all these fluoroquinolones, they are also active against certain atypical bacteria which causes pneumonias. For example, they are active against mycoplasma. It's an atypical bacteria and causes atypical pneumonia. Then we have chlamydia, and legionella. Also, they have activity against Mycobacterium tuberculosis. So both these Legionella and Mycobacteria, these are intracellular pathogens, and the intracellular pathogens are usually very difficult to treat. So it's a good thing that fluoroquinolones, they have activity against these intracellular pathogens as well, along with the Mycoplasma chlamydia, which causes atypical pneumonia in humans. So this is a spectrum of activity, and based on the spectrum, we can have an idea of their clinical uses as well. But first, we'll discuss the mechanism of action of these drugs. So fluoroquinolones, they have activity against gram-positive as well as gram-negative bacteria. The one-liner for the mechanism of fluoroquinolones is that they inhibit bacterial DNA synthesis. So they are inhibitors of DNA synthesis in the bacteria. They have different mechanisms in the gram positive and gram negative bacteria. In the gram negative bacteria, what they do is that they inhibit an enzyme which is known as DNA gyrase, or it is also known as topoisomerase 2. So this topoisomerase 2, which is also called as DNA gyrase, it is present in the gram negative bacteria, and fluoroquinolones inhibit this enzyme in gram negative bacteria. Now in the gram positive bacteria, the mechanism is slightly different. In the gram positive bacteria, they inhibit an enzyme which is called as topoisomerase 4. It has a different mechanism than the topoisomerase 2. I'll explain that in detail as well. So they inhibit in the gram positive, they inhibit the topoisomerase 4. So now we will discuss a little bit in detail that what this DNA gyrase does. As we know that the bacterial DNA, it is in a supercoiled form like this, and this supercoiled form of DNA, it has to be in order to replication, it has to be uncoiled into two strands like this. It has to be decoilated, it has to be uncoiled in this form in order for the process of the replication. So this uncoiling, it is mediated by the enzyme which is called as DNA gyrase, the enzyme we just talked about. So this DNA gyrase, it causes the uncoiling, and this uncoiling usually reveals two strands, and then the process of replication occurs. Now what fluoroquinolones do is that they inhibit this enzyme. They inhibit the DNA gyrase. As a result, there will be no uncoiling and the process of replication will be inhibited. So this is how they inhibit the process of DNA replication in the gram negative bacteria. Now in the gram positive bacteria, we'll continue from this step in which the DNA has been uncoiled, and after the replication, the DNA strands, it forms a catenated DNA, which is basically, after this process of replication, there is the formation of a catenated DNA in which the strands of DNA, they are interconnected to each other like this. They're chained together, and this is known as catenated DNA. Now, in order to become daughter or in order to become replicated bacterial DNA, it has to be decatenated, which means that these strands, they need to be separated, and then when they are separated, there are two daughter DNA strands produced from this catenated DNA. And this process, this uncoiling or this decatenation, it is brought about by topoisomerase 4. So this topoisomerase 4 right here, it basically decatenates this DNA and the replicated DNA comes out of it. So now what fluoroquinolones do is that they inhibit this topoisomerase 4 enzyme, and this is how it prevents or it inhibits the replication of DNA, and this occurs in the gram positive bacteria. So this is how fluoroquinolones, they exert their antibacterial effect. I'm going to revise, or I'm going to repeat it, that in the gram positive, in the gram negative bacteria, it inhibits the topoisomerase 2, which is also called as DNA gyrase, which causes the uncoiling of the supercoiled DNA. And in the gram positive bacteria, they inhibit topoisomerase, which causes the decatenation of the DNA. In one line, they are inhibitors of DNA synthesis, and this is how they have their antibacterial effect. They all the fluoroquinolones, they share the same mechanism of action. Now we will move towards the pharmacokinetics of these fluoroquinolones. So fluoroquinolones, they are very effective in the treatment of infections of the urogenital tract, which means they can be used to treat UTIs and cervicitis and urethritis, cystitis, and the infections of prostate, and they are useful in the treatment of gastrointestinal tract infections as well. Any infection that is caused by gram-negative bacteria, which includes gonococcus. However, it is not used in the treatment of gonococcus now because of an emerging resistance, but infections caused by E. coli or Klebsiella, and even it has activity against Pseudomonas aeruginosa, has activity against Shigella, Salmonella, Enterobacter, and Campylobacter jejuni. So all these gram-negative bacteria, fluoroquinolones can be used for the treatment of any infection caused by these organisms. They're also very widely used to treat respiratory tract infections. The third generation fluoroquinolones are also known as respiratory fluoroquinolones because they have activity against gram-negative bacteria and also the atypical bacteria, which we discussed in the first portion of this video. They are also used to treat skin and soft tissue infections as well because of their very broad spectrum. Skin and soft tissues can also be used. Cipro and ofloxacin in the oral dosages, they have been used as an alternative to ceftriaxone or cefixime in gonorrhea as well, but now they are not currently recommended because resistance is very common. So ofloxacin is the drug which also it is now used in the treatment for chlamydia, trachomatis. A 7-day course of ofloxacin is required for the treatment of chlamydia trachomatis. Levofloxacin has activity against most organisms that are associated with community-acquired pneumonia, including chlamydia, mycoplasma, and legionella as well. And among all these, we discussed levofloxacin, and among these, the moxifloxacin and gemifloxacin, they have the widest spectrum of activity. So they include both gram positive and gram negative. So the gram positive are covered, gram negative are covered, and atypical bacteria that causes atypical pneumonia, they're also covered. And there are few anaerobic bacteria which are also covered by moxi and gemifloxacin. So they're used to treat all these kind of pneumonias and infections. They have also been used in the meningococcal carrier state in the treatment of tuberculosis and in the prophylaxis of neutropenia. So this was all about the fluoroquinolones.